to Senator Ricketts. If you're,
Great, thank you, Mr. Chairman.
we have other senators on their way, so as
Well, if they're not here, they don't get to go.
you jump right in. Jump right in.
All right, good. Thank you very much, Mr. Chairman. Well, as we know, many seniors and vulnerable Nebraskans are faced with challenges of protecting themselves and their loved ones from the threat of fraud, abuse, and financial exploitation. Financial losses due to scams continue to rise, particularly among older Americans. In 2022, consumers reportedly lost $9 billion to scams, a 30% increase over the year before. Older adults reportedly lost over $1.6 billion to scammers. The Federal Trade Commission has reported a tenfold increase in bank scams in the last 3 years. Scammers are also taking advantage of complex health care and insurance coverage decisions by impersonating the Medicare program. Late last year, officials with Nebraska groups that manage care for seniors began noticing a sharp increase in billings to Medicare for urinary catheters. Quarterly Medicare data for One Health in Nebraska indicated that spending on these devices on behalf of their patients was up an average of $60 a patient, totaling more than $1 million. The fallout from the scheme and the harm done is still unknown. Many people affected by the scheme may not even be aware that they have been scammed. Ms. Whittaker, we know that elderly population is disproportionately targeted by malicious scam calls. Do you believe an education and awareness of how these scams work could better prepare those being targeted? And how would you approach being able to make people aware?
Thank you. Absolutely, I believe that education is really important. And we at the Area of Aging, we've put together posters, flyers, pamphlets, magnets, and we have a folder that we actually take out to each individual that we're going to see. And this information is right inside the folder, including the magnet. Who to call in case you are a victim of fraud or you feel that there has been a scam taking place. It includes the fraud hotline, the Attorney General's number, the local police officer, state police, I believe is the phone number that's on there. And it walks you through the steps of exactly who to call and what to do.
And how do you distribute that? How do you get that information out?
We have an advisory council, and the advisory council members distribute some of that information for us. In addition, our assessors take a folder out of all of Aging's information to every individual that they see. One of our assessors may, I believe the assessors see about 200 people a week, if not more. So we're getting that out to at least 200 people, 800, 1,000 people a month. And the assessors do walk through that information. If you are receiving waiver or option support, that is also covered by those that are going out, our aging care managers, and are seeing them.
So it's a very one-on-one.
Very one-on-one. We also did a scam seminar for the public and for healthcare workers at DeSales University. That was just this past year. I don't want to quote the month because I could be wrong, but we had a huge attendance. And I've learned that Scott's associate was the person doing was one of the presenters. We had representation from the local banks, the district attorney's office, some of our own detectives, Aging. So we held that and made that available to anyone that was interested in attending.
Great, thank you. Ms. Moore, there's a long list of ways scammers can take advantage of seniors. Are there certain methods of scamming that are more prevalent in rural areas?
Oh, thank you. That's a good question. I think most scams start by telephone or text, whether they're rural or, urban beneficiaries. I do think the telephone, communications, we need more safeguards, and calls can be spoofed and labeled to look like they're coming from a legitimate organization or with their area code and even prefix. So people tell me they're more likely to pick up. We tell people not to answer unsolicited calls or calls they don't have in their phone, or, if they have a landline, sometimes you can put in certain numbers. But I would say the telephone is probably the worst offender.
And do you think for rural areas, are there different ways of outreach or education that we need to approach when we're thinking about how do we educate seniors in rural areas?
That's something we, as a program, we, work on. I think print media is better in rural areas. And I do think, we try to get to the very small towns and counties in our state through just presentations, through area agencies on aging, or we have some senior centers. I have one of our partners does she sets up a table for about S&P and other services that the AAA offers in a free laundromat day for seniors. So we need to think really outside the box, maybe even hair salons and that kind of thing, to get to people that maybe aren't on the internet, don't, maybe see the news and that kind of thing.
Yeah, and I appreciate that, because I think you're exactly right. Thinking outside the box about how you reach seniors in rural areas is an important thing to do. And I would just emphasize what you said about print. Those weekly newspapers that are in rural Nebraska, and I'm sure in other parts of the country, they're read cover to cover, and they stay on the kitchen table or on the coffee table for a week. So if you have an ad or a story or anything like that in those, that's a great way to reach the seniors, because they're read cover to cover, and they leave them out for the week until the next edition comes out. Thank you, Mr. Chairman.
Senator Ricketts, thanks very much. I'm going to do some questions now in a second round, because I know we have at least two or three more senators